Ministers have announced plans to encourage building on brownfield sites in England. The government is opening a consultation of this, designed to make it easier for developers to get planning permission from local councils. This, of course, housing a big issue. It continues to be. Suzanne Mooner is Secretary of the Social Housing Action Campaign and is joining us live on LBC News. Thank you for your time. What do you think of what the government has been announcing here today?
Well, I think it'll make their friends in the construction industry very, very happy to know that the planning laws are going to be relaxed even further. In terms of actually helping people who are homeless, who are struggling with the condition of their current housing, or with any of the manifestations of the housing crisis that, has been covered on LBC before, this really isn't going to make very much difference to them at all. Because what construction firms really want to do is to build for the maximum profit. So they're looking at the homes that they can sell for the highest rates. What we need to be looking at is much further down the chain, and looking at the needs of people who haven't got a lot of money, who are struggling to be in secure accommodation, to be in accommodation that is large enough for their families, that is in a decent condition. And that's really where government should be looking at, rather than just looking at making it easier for people who are going to be funders to their political party to actually build even more homes that, a lot of ordinary people can't afford.
I think the developers would say that the housing market is the housing market, and it's not really in their interests to do things if they're not going to make any money on it. They're not a charity, are they?
Yeah, no, I agree with that. And that's why I think we shouldn't be leaving it to private companies to actually take charge of housing supply in Britain. And increasingly that is the case. I think there's about a third of all local authorities now don't own any homes of their own. They don't own any council housing. It's all been either handed over or sold on to housing associations or to private companies, to the big purely private companies. I mean, housing associations are private companies. But for those companies, you're absolutely right that what they're looking at and what they have to pay attention to more than anything else is the bottom line, is about satisfying lenders. We need a system of public housing that is based on the needs of people, of ordinary working people and people who maybe aren't in work, aren't able to work, but need to be in safe, secure, decent housing. And we can see, the knock-on effect. I mean, even things like, for example, the cost of having people, the cost to the NHS of having people in poor housing. We hear story after story, and MEDAC has done, the charity has done quite a lot of work on this, looking at the cost to the NHS of poor housing in all sorts of ways, injuries and also illness, like, people with breathing difficulties. This is costing the public sector by not having decent homes that people can afford to live in. So we need to look at a solution, even if it costs councils money. We invest in the councils to actually build housing that is truly publicly owned. And
of course, councils, though, strapped for cash, aren't they, at the moment? There's not money just sitting there to spend on this kind of thing.
Well, that's certainly the impression that I think government likes to give, but it's amazing how much money can be found. I mean, how much money was poured down the drain, during COVID on PPE that couldn't possibly be used because it just wasn't fit for purpose. Like I say, it's actually costing. I mean, in a more recent example, it's costing the NHS now millions of pounds every month to look after people whose health has deteriorated as a direct result of being in unsafe housing, in housing that has got mold, has got damp, has got leaks. It is, structurally unsafe, and people are getting harmed as a result of that. And that's just looking at what it does to the health sector. It also draws on, public resources in lots of other ways. It disrupts children's education. It disrupts people's ability to earn a living, and therefore they are signed off sick. So it's actually costing us as a society and as taxpayers an awful lot of money to have such an awful housing crisis. So if we deal with the housing crisis, it's actually, in the long run, it is actually going to save us money. It's not a one-way street.
Suzanne Mooner from the Social Housing Action Campaign. Thank you very much for